This lecture is about the digestive system. I suggest we first review some basic anatomy and then pass on to major digestive symptoms and diseases. Before going through the main diagnostic tools and treatment options, we will have a look at the questions a doctor should ask if he suspects a digestive problem. The organs of digestion are divided into two main groups. First is the gastrointestinal tract that extends from the mouth to the anus and includes the pharynx, the esophagus, the stomach, which contains four areas: the cardia, the fundus, the body, and the pylorus. The small intestine, which contains the duodenum, jejunum, and ileum, and the large intestine, which comprises the cecum, the colon, the rectum, and the anal canal. The second group of organs are the accessory structures. They comprise the teeth, the tongue, the salivary glands, the liver, the gallbladder, and the pancreas. Now, let's talk about the membranes. The largest membrane of the body is the peritoneum. The outward fold of the serous coat of the small intestine is called the mesentery. The fold which binds the large intestine to the posterior abdominal wall is called the mesocolon. The largest peritoneal fold that drapes over the transverse colon is called the greater omentum. Now, let's have a look at the symptoms and diseases. The acute inflammation of the peritoneum is called peritonitis. The accumulation of serous fluid is called ascites. A portion of the stomach protrudes superior to the diaphragm through the esophageal hiatus is called hiatal hernia. The lower esophageal sphincter fails to relax as food approaches. It's called achalasia. The forcible expulsion of the contents of the upper GI tract through the mouth is called vomiting. The inflammation of the pancreas is called pancreatitis. The yellowish coloration of the sclera is called jaundice. And the inflammation of the gallbladder is called cholecystitis. The inflammation of the appendix is called appendicitis, and varicosities in the rectal veins are called hemorrhoids or piles. Development of diverticula is called diverticulosis. Defecation of liquid feces is called diarrhea, and difficult defecation is called constipation. Gas expelled from the mouth is called eructation, also known under the term belching or burping. Gas expelled from the rectum is called flatulence. We can also use the word wind or fart, which is a little bit vulgar. Disease of the entire GI tract in which a person reacts to stress is called irritable bowel syndrome or IBS. Difficulty swallowing is called dysphagia. Now, let's review the questions you should ask your patient if you suspect a digestive problem. General questions like, how are your bowels? Have you noticed any change in your bowel habits? Did you open your bowels? Did you pass any stools? You may want to know whether your patient suffers from diarrhea, in which case your question is going to be, are your motions loose? If you want to know whether your patient suffers from constipation, then your question is going to be, have you had constipation? You may want to know whether your patient suffers from flatulence, in which case your question is going to be, did you pass gases? Did you pass wind? You may want to know whether your patient bleeds. Did you pass blood? Was it bright red or dark brown? You may need to inquire about your patient's appetite. What's your appetite like? Have you lost your appetite? You may want to know whether your patient suffers from dysphagia. Do you have difficulty swallowing? Do you regurgitate? Eructation. Do you belch? You may want to know whether your patient suffers from nausea and vomiting. Do you feel nauseated? Do you vomit? You may want to know whether your patient suffers. Do you feel any pains in your abdomen? Now, let's pass on to the physical examination. During the physical examination, first, you're going to have to observe the abdomen from different angles, looking for swelling of the abdominal wall that might accompany abnormal growth or enlargement of an organ. Place a stethoscope on the abdomen, through which you are going to listen for sounds that normally accompany the movement of materials through the intestines and for any abnormal sounds. You will need to feel for tenderness and any abnormal masses or enlarged organs. The anus and rectum may need to be examined with a gloved finger, and a small sample of stool is sometimes tested for hidden blood. In women, a pelvic examination often helps distinguish digestive problems from gynecological problems. With our next slide, we're going to review the main diagnostic tools. First, let's talk about liver enzymes tests, formerly called liver function tests. They are a group of blood tests that detect inflammation and damage to the liver. Fecal occult blood test checks for hidden blood in the feces and is used as a screen for early colon cancer. Colonoscopy is the endoscopic examination of the large bowel and the distal part of the small bowel with a CCD camera or a fiber optic camera on a flexible tube passed through the anus. EGD is a diagnostic endoscopic procedure that visualizes the upper part of the gastrointestinal tract up to the duodenum. Barium enema is an X-ray examination of the large intestine, which is filled with a contrast material that contains barium so that the intestines can be seen. ERCP is a procedure that combines upper gastrointestinal endoscopy and X-rays to treat problems of the bile and pancreatic ducts. Now, let's focus on treatment options. First, among medication that you might prescribe, laxatives. They are substances that loosen stools and increase bowel movements to treat constipation. Antispasmodics are used to prevent spasms of the stomach and intestine. Anti-motility agents are used to alleviate the symptoms of diarrhea. Proton pump inhibitors, or PPIs, are a group of drugs whose main action is a pronounced and long-lasting reduction of gastric acid production. Among surgical procedures, let's name appendectomy, or API, which is the surgical removal of the appendix and is normally performed as an emergency procedure when the patient is suffering from acute appendicitis. A cholecystectomy is the removal of the gallbladder and is a common treatment of symptomatic gallstones. A colostomy is a surgical procedure in which an opening, or stoma, is formed by drawing the healthy end of the large intestine or colon through an incision in the anterior abdominal wall and suturing it into place. This opening, in conjunction with the attached stoma appliance, provides an alternative channel for feces to leave the body. Thank you for your attention.